For most people, our skin is just there. We take it for granted. It's there when we wake up. It protects us from harm. Skin gives us sensation, touch, and feeling. It lets us move and grow. It regenerates when we get hurt, and it always comes clean. We even use it as a source of vitamin D3, and most of us don't even realize. But it's also delicate, and we can damage it really easily. If you have to spend most of your time in bed or in a wheelchair, you are at risk of developing a pressure ulcer or bed sore. A pressure ulcer is an area of skin which has been damaged by remaining in one position for too long, or if your skin has rubbed on your clothes or bedding when moving. You can develop a pressure ulcer in only 20 minutes and is first noticeable as a darker area of skin or an area that's redder in appearance. If left untreated, it can develop into a deep hole in the flesh. You are most likely to develop a pressure ulcer where the bone is close to the surface of your skin, or areas which take your weight, like your heels and hips. The best treatment for pressure ulcers is to prevent them from happening in the first place, and if your skin is healthy, you are much less likely to develop one. To help, you should eat a healthy diet and drink plenty of liquid. Keep your skin clean and dry, remembering to rinse soap off well and pat your skin dry rather than rubbing. If you spend long periods in bed, then you should try to change your position at least every 2 hours and alternate between lying on your back and on your side. You can use pillows to stop your ankles and knees rubbing together. And you should try not to get creases or crumbs in your bed sheets. If you are a wheelchair user or spend a long time in a seated position, then you should try to take the weight off your bottom every 15 minutes by leaning forward and move from side to side for the length of time it takes you to count slowly from 1 to 15. Or, if you can, push up on the arms of your chair, again whilst you count to 15. You should repeat this 4 times. You should check your skin regularly for the warning signs, particularly over bony prominences. Or, if you are experiencing pain or soreness, then an urgent check is required. You should check if the skin is warmer to touch than the surrounding skin. For dark or black skin, is there a change in colour or is it darker? You should then apply light finger pressure for 10 seconds to the area and consult traffic light for instructions. If you can't carry out regular checks yourself, then you should request assistance from your nurse or carers. Your nurse can show you how to move and change your position safely, and they may request a special bed, mattress, or cushion if they think it will help. Sometimes, pressure ulcers can develop even when you are doing everything you can to prevent them. Any skin breakdown requires urgent attention. But don't worry, pressure ulcers can be cured with a prompt treatment. Remember to always ask for help if you think you need it.